Hi everyone, my name is Olushola Analubi and I'm presenting cholera disease. Outline for cholera disease, I'd like to talk about the introduction, the history, the causative agents, and the sources of infection, infection site and the transmission, the germ characteristics, the sign and symptoms, the health issues and complications, the treatment and vaccination, contagiousness and fatality, animal carriers, the safety measures, statistics, and impact of cholera disease. Now, let's talk about the preventions and then conclusions, and we'll have the references, which is also the works cited page. Then history of cholera disease was dated back in 1899, which lasted until 1923. It all started back in India and it came to Eastern Europe through Russia. Then we have the sources of transmission, the infection site and transmission. Cholera is transmitted mainly through contaminated water or food. And also the bacterial infection that affects the small intestine. The infection starts when someone ingests food or water contaminated with the bacterium Vibrio cholerae. Bacteria is then colonizes the small intestines and produces toxins that cause the body to lose electrolytes and fluids, leading to watery diarrhea. And cholera transmission is a significant risk in areas with inadequate sanitation, restricted access to clean water, and poor hygiene habits. The germ of cholera characteristics. It's a Vibrio cholerae and is classified as a germ gram-negative bacterium. This classification indicates that it has a thin peptidoglycan cell wall and an outer membrane that contains liposaccharide. The signs and symptoms of cholera are as follows: vomiting, severe dehydration. Signs include thirst, decreased urine output, dry mouth and skin elasticity, muscle cramps, mild fever, and that's about it. Health issues and complications of cholera disease. We have the short-term and the long-term health issues. The short-term, basically, if it's untreated, cholera can lead to severe dehydration, electrolyte imbalance, kidney failure, shock, and death within hours. Then the long-term health issues for some survivor, they may suffer from lasting effects like persistent diarrhea or malnutrition, especially in children. Then the complication is that it includes severe dehydration and shock, which can lead to organ failure and in extreme cases death if treatment is not initiated quickly. Then I'm going to talk about the treatment and vaccination. Basically, the mainstream of cholera treatment is rehydration, using oral rehydration solutions or intravenous fluids for severe cases. And the vaccinations are oral cholera vaccine, which protects for at least 3 years and can play an important role in short-term risk reduction, complementing long-term water and sanitation interventions too can help. Then preventions. Preventing cholera infection has been widely tackled in the literature, with clean water and sanitation being the mainstream of prevention. A well-known cholera prevention strategy termed water, sanitation and hygiene, which is WASH, is providing safety. However, the global achievement of WASH still requires many years, especially that endemic areas do not prioritize such programs, leading to an inadequate cholera prevention. Additionally, implementing cholera prevention strategies is hard in countries where healthcare is under-prioritized and conflicts are common, just like I said about Nigeria. Preventions also, a comprehensive approach that includes enhanced leadership, disease surveillance, laboratory support, clinical care, cholera vaccination, provision of safe water and sanitation, and social behavior changes can help prevent cholera disease outbreak. Then, to conclude this presentation, I'll say cholera disease is actually a preventable disease that poses a serious threat in areas lacking adequate sanitation and clean water. But timely rehydration and medical treatment, along with preventive measures like vaccination and improved hygiene, can significantly reduce the impact of cholera on affected populations. Thank you. Then the works cited pages. Thank you.